So I'd like to say thank you for taking time out of your day to join us. I'm Amber Donnelly. I'm the chair of the CPRC, and this is the first of 3 webinars for the Strategies in Cytology Education. We all wish we could be together, that we would have been at the ASC meeting together in person, but since that didn't happen, this is our next best option. So just a few housekeeping items. Please remember to keep yourself muted through the entire webinar. And if you have any questions, please type them in the chat. Okay, and so if you type them in the chat, please type them to either everyone, or you can type them to me privately if you don't want people to see your question and know who it's coming from. So again, Amber Donnelly, you can choose who you send it to. I will be reading the questions at the end of the presentation, and we will go over any questions during the Q&A session. So the presentation will last approximately 45 minutes, maybe 50 minutes, and then we'll have some time for a Q&A session following that. So I'd like to welcome Keisha Burnett, who is the program director at the University of Tennessee. We're delighted to have her speak with us today, and I'm going to let her tell you the title of her presentation. So I'll turn it over now to Dr. Burnett.
And before I get started, I would like to give you a brief summary of how our program is structured. We are a 21-month master's level program divided into 4 semesters. And our program offers training in both cytotechnology and histotechnology. And we have first and second year class of students. We currently have 7 students in the second year class, which will be graduating this upcoming May. And we have 5 students in the first year class, which started back in August. Now let's review this timeline of events leading up to the quick changes that our program had to make in response to the COVID pandemic. On December 31st of 2019 is when COVID-19 was first reported to the World Health Organization. And followed in January, towards the end of January, we had the first laboratory confirmed case of COVID in this country. And 10 days later, the Director General of the World Health Organization declared this outbreak to be a public health emergency and issued a set of temporary recommendations. By the very beginning of March, our campus, which is the University of Tennessee Health Science Center, requested that all of the programs develop and submit a modified plan for their lecture and lab instruction. By this point, it was already decided that in the event the campus closed down, that the didactic lectures would be given online. And I would say 9 days later, the World Health Organization declared COVID-19 to be a global pandemic. And 2 days later, without any notice, any early notice, our campus shut down and it was restricted to only essential workers. And when I mention essential workers, they define that as the individuals who maintain the building, who clean the buildings, and some administrative staff. The faculty were all told to take home items that we would need to teach online. And all of the lab and microscopic sessions were suspended on campus indefinitely. So needless to say, this pretty much threw us into quite a disorienting dilemma. We had first and second year students, and our first year students had just begun studying body cavity fluid cytology and as you already know, body cavity fluid cytology can be very difficult and challenging to teach the students. And we also had students working on research projects in histology. We also had a histology lab course going on, as well as a cytology prep lab course. And for our second year students, they were getting ready to go on rotations from March 23rd until May 1st. So needless to say, this really put us in a very sticky situation where, you know, we were pretty much thrown into the water and told to swim. And, you know, we were just trying to figure out how were we going to do all of this, going to pull this off in such a short period of time. And we were a little confused and unsure about the future. We didn't know if our plans would eventually turn out to be long-term, or is this just short-term? And we were quite disoriented. And we were faced with a couple of unknowns. The first thing regarding our clinical sites, because of the pandemic, would the sites allow our students to complete the rotations? And if not, would we have to postpone graduation and conferring of degrees? Our second year students were scheduled to graduate May 11th. The second thing was, would we be allowed to come back on campus in time to complete labs and microscopy assignments? And our semester ends, our semester typically ends the week after graduation, which was again in May. And the second thing we were wondering is if we're out for an extended period of time, how are we going to be able to sustain the lab and microscopy instruction? And then finally, would we have to give students a grade of incomplete for the spring semester, which we were desperately trying to avoid that. But in times of chaos, there's order. And we definitely had to get organized and put our thinking caps on and brainstorm and come up with some reasonable plans as far as how we were going to be able to navigate during this time. The first thing we did was assess our strengths. And we were pretty confident that we could present our lecture material taught online. As I mentioned previously, our 21-month program is divided into 4 semesters, and we had already gotten through the first semester, and we were in the middle of the second semester when the pandemic hit. Thankfully for us, our third and fourth semester program lecture courses were already taught online. By the third semester, which is our summer semester, we teach fine needle aspirates. And by that point, our students, again, already have a pretty good foundation in cell morphology and cell types. And so what we decided to do almost 10 years ago was put the fine needle aspiration body site lectures online and give subsequent review sessions face-to-face. And we found that to be pretty successful. The fourth semester lecture courses does not contain or include cytology. So by the fourth semester, we have pretty much covered every single body site that the students needed to learn. And the fourth semester was pretty much lab management, and we were doing we do cytology rotations. And we also have an ethics course that again was all given online. So we already had those lectures up and running using the Articulate software. Before that, we used Adobe Presenter, but because Adobe Flash is about to end at the end of December, the university decided to stop supporting Adobe, and we currently do not have any type of teaching software supported by the university. I was very fortunate to apply for a grant through the ASCP Foundation, and with that grant, I was able to purchase the Articulate software, where we were able to convert all of our current lectures in Adobe Presenter over to Articulate. So again, we were pretty successful in that, and we were pretty confident that we could convert all of the other lectures over to this software as well. We're also fortunate in that we have a very efficient learning management system, which is Blackboard, and we found that the Articulate software was quite compatible with Blackboard, and we would save our lectures as zip files and post them onto Blackboard. And we were also able to develop quizzes in Articulate and upload those into Blackboard as well. But with the strengths, we also had some weaknesses. We had absolutely no well thought out plan for how we were going to conduct microscopy instruction online. Zero confidence in teaching histology and cytology prep lab online. And at that point, we did not have a well thought out contingency plan if the rotation sites turned away our students during the pandemic. So we were faced with, quite a few challenges. And just as we were trying to come up with a plan for the clinical sites, the clinical sites canceled all the rotations, which was quite disappointing. But we can stay disappointed for a while, but we shouldn't stay there too long, because that can hinder us from thinking things through and coming up with a reasonable and logical solution. So this is the plan of action that we came up with. We decided to postpone all of the cytology and histology hands-on labs until the campus reopened. We decided to move forward with recording our existing lectures in Articulate Presenter and uploading them into Blackboard. And we also came up with an idea to give lecture review sessions as well as cytology multi-head sessions through Zoom, and we decided to record these in case the students wanted to go back and review the cytology multi-head or the review sessions, and we were able to upload those onto Blackboard as well. Because of the campus being closed down, we were not allowed to have our students go to the computer labs on campus to take their exams, which is what we did before the pandemic. So at the very last minute, I had to sign up and get a license for the ProctorU service, which is the service that we use to proctor on our online exams. We initially thought that we could proctor the exams on Zoom and have the students get on Zoom and we just, proctor the exam ourselves. And we actually tried that out, I would say maybe for about a good 2 weeks, and we decided that it was very time consuming, and we are not professional proctors, so we really had no way of knowing, if the students, were being honest. And so we just decided to take that stress off ourselves and hand it over to ProctorU. So we went through the process of scheduling all of our exams from that point to the end of the summer semester. And the students with ProctorU, they would go in, they would find the test, and they would go ahead and schedule a time to take their exam. We also decided to provide the students some enrichment in GYN instruction by using the Hologic digital slides that were provided to us by Sarah Harrington, and she was very helpful in assisting us in doing so. And to make it more of a quiz or a testing type situation, what we decided to do was not give access to the students to the Hologic website, but rather save the images and email them or upload them into Blackboard and have them take a look at those images from each case and provide a diagnosis. We also gave students microscopes to take home, and I must say that I was pretty nervous about this at first, because I was just thinking the very worst, the worst possible things that could happen, that they would break a microscope or mess up something. And my other full-time colleague and I, we just had to say, if they break something, they break something, and we will just have to deal with that when the time comes. But we cannot hold off on continuing the microscopic instruction. That would have been pretty detrimental to their learning, and it would have set them back so far that we just did not want to have to face just constantly being in a mode of trying to catch up. So what we decided to do was give slide sets to the students to screen, and we would meet in the parking lot each Friday and swipe out slide sets and collect the screening sheets. We also did the same thing for their practicals. We did give practicals, but what we decided to do was to create several practicals of equal difficulty, equal levels of difficulty, and give them to the students, and we would pick up the slide practicals and grade them in the same manner that we did the slide sets. And because I was not able to come on campus for quite a while, I had to come up with a way to teach the microscopy. And what I decided to do was take one of the existing microscopes that we have, and this is a pretty old microscope. I believe this is the Olympus BX40. And this microscope, as you can see, does not have a trinocular feature at the top of the microscope. And after thinking about it for a while, I thought, well, maybe there is a microscope camera that I could use with just one ocular. And so what I did was I looked up this company called Amscope, and Amscope have relatively inexpensive microscope cameras. And the microscope camera that you see here is actually a Wi-Fi microscope camera that I was able to easily assemble and upload the software. And I had to pull out one of the oculars to insert the microscope camera, as you can see here. And again, this is a Wi-Fi camera, so I was able to, with this, I was able to live stream this on Zoom, via Zoom. So I would pull up Zoom. I would switch the Wi-Fi over to this microscope camera, and from there, I would share my screen with the students. And the photograph to the right is just an example of how the microscope camera looked. And so I was able to show the students, special cases, multi-head cases. And for the microscopic course, what I did was, not only would I do some live multi-head sessions, I would also record the multi-head session and require them to review it before any sort of quizzes, before we gave quizzes. So I still have this set up, and this is actually my little home office that I created at home, and I still have it set up this way. It's not very convenient to look out of one ocular to navigate the slide and and show things, but it was doable. I was able to do it. However, I have talked our department chair into purchasing another microscope that has a trinocular feature to it so that I can, install the microscope on the trinocular. And, that way I can be able to use both oculars in navigating while I'm teaching. So continuing on with the plan of action, we had to come up with how we were going to work out this cytology rotation. Initially, we thought, well, we'll just have to postpone graduation. But I mean, really, we did not want to do that. We did not want to do that to the students. And so what I decided to do was I contacted the clinical sites that took our students here in Memphis, and I asked them if they could just pull together a number of GYN and non-GYN slides, along with patient history and the diagnosis key, so that we could, give those to our second year students. And we also gave the second year students microscopes. We met each week and gave new slide sets. And what we did was the slides that they had questions about or they were unsure about, we asked them to circle those slides with the cells that they, that they were having trouble with. And after grading the screening sheets, we would then go over the cases that they were unsure about with the microscope camera software over Zoom. Luckily for us, the second year students received all of their instructions on how to make smear preparations from FNAs, and they learned the dip quick staining, and they also got a chance to observe EBUS and EUS procedures before the pandemic. We actually do that during their second laboratory techniques course, which is our second cytology prep lab course. And thankfully they had already taken that course the second semester. And we were very aware that those are entry-level competencies that are required by a lot of institutions and laboratories for employment. And so I would say that we were extremely lucky, the timing of it all, because had we not taught that before, we really would have been in a far off worse situation. So listed here are the outcomes for spring 2020. Our second year students did successfully complete the home rotation, and they were able to graduate on time with May. They've already passed their ASC board exam in cytotechnology. There were some scheduling issues with Pearson, which is who we use for our testing. However, they were able to schedule. They graduated, I believe, May 11th, and they both scheduled to take their exam mid-June actually, and they passed, and they're currently employed. They are currently employed in either histology or cytotechnology. Luckily for us, our first year students were allowed to come back on campus for the labs and the microscopy only. So we still had to continue to teach our didactic courses online. So we just moved forward with that. Now, as I mentioned previously, our spring semester actually ended, it was supposed to end the week before May 18th. And because of this, because of the timing of when we were allowed to come back to campus, we saw this as an opportunity for us to do some aggressive teaching of microscopy, aggressive laboratories and histology and cytotechnology, for them to get caught up on the lab work that they missed. And June is traditionally a summer break for us. We typically, the faculty and the students have the whole month of June off. And the month of June is our time to regroup and prepare for the summer fall semester, get all of our course syllabi together, if we want to make changes. But not this time. We did not have time to do that. So we were pretty much knitting the sweater as we were wearing.
How you doing?
And so with this aggressive way that we did things, we scheduled lab microscopy makeup sessions from 8 a.m. to 3 p.m. every day. And we also offered weekend sessions for students to complete their research projects, as well as, if they had any time during the week, they could, work on their research projects and complete those as well. So the second semester grades for and what we found with this model, and I consider this kind of a hybrid model at this point. What we found is that the second semester grades for the first year students in both the lectures, the labs, and the microscopy courses were actually comparable to the grades from the previous year. So, that let us know that, we felt at this point that we were doing a pretty decent job in navigating all of this. So with summer fall, which is, we're in currently the fall semester now, our campus is still closed. And the only thing that's open are the labs and the microscopy rooms. And our lab and microscopy rooms are pretty small, which presented as a challenge because we were told that we had to make sure that the students were properly socially distanced in the course. And that was pretty difficult because the way our microscopy room is set up, we have a divider, and on one side we have the first year students, the second side we have the second year students. And what we ended up having to do was, because that room was so small, we ended up having to schedule staggered times that the students could come in for first and second year instruction. And the students were a little down about it because they're so used to being with their group and collaborating and doing things together. But this was an absolute necessary thing for us to do to ensure the safety, health and safety of the students and the faculty. So there are several things that we learned from this experience. First thing is that we showed that we could successfully navigate ourselves through a disorienting dilemma. As I mentioned before, we only had maybe like a week between the time that the pandemic became official and the the campus shut down for us to come up with a plan. We initially came up with a plan, for how we were going to stagger students, and then we were just totally thrown off guard when the campus just shut down completely, and we were told that we could not move forward with the plans for microscopy and lab sessions. The second thing we learned is that, contrary to old beliefs, we found that cytology lecture courses and microscopy could be taught online. Now, it wasn't the most ideal situation. However, the grades that we saw, as an outcome with this, we found again that the grades for these classes were pretty comparable to previous year classes. Another thing we found is that teaching the lectures online created a whole lot of room and time for us to spend at the microscope, as well as extra time in lab, which are skills that are very necessary for them to be successful out in the workplace. So what we found was we were able, again, to spend more time in microscopy, which was, extremely valuable. And the students even commented that they felt that they were learning more, and, they were able to absorb the information more because they were spending time specifically on microscopy and not having to get up and go to class at a certain time. Another thing we learned is that the online teaching requires a much higher level organization and discipline. And we typically, take these types of things for granted when we're in a face-to-face classroom. In a face-to-face classroom, it was a little bit easier for us to change the schedule around, or, change certain things. But when you're in an online environment, it can be a little challenging to change up things. And it's even more of a challenge when, again, you're not able to see your students on a regular basis. So moving on with other things that we learned, we learned that there were a lot of challenges with teaching online. And I do want to go back and mention that, again, we have we have the third and the fourth semester. Our didactic courses are online. However, we had never taught GYN cytology, which is what we teach at the very first semester. We had never taught that online before. And so we were pretty concerned as far as how well the students would grasp the basic cell morphology, the basic cell types, without us being in a face-to-face classroom. We found that there were a lot of tech issues that falls on the responsibility of our campus technology department. We actually had a lot of internet crashes. We had a couple of Blackboard glitches and Blackboard clashes, because we had never had this many faculty on campus trying to teach it online all at once. So the university had to expand our tech capabilities, expand our bandwidth to to accommodate the faculty in teaching online. Another challenge is, being able to decide if you want to teach synchronously or asynchronously. Because we have two classes going on at the same time, and there's only two full-time faculty, with myself being included, we decided that an asynchronous platform was going to work better for our program schedule. So with asynchronous, of course, as you already know, that's when you have the course material readily available to the students, and the students can review this material at their leisure, on their own time. And what we found was that the asynchronous platform minimized the travel days to campus. Now, I do want to mention that there are several courses in our program that are taught by the medical laboratory science, our medical laboratory science faculty. One of those classes being an intro to clinical laboratory sciences course. And the way that instructor had things was that she chose to have synchronous, where the students all had to be on Zoom at one time and listening and watching the Zoom lecture live. But it presented a challenge, because sometimes the lectures would go over a little bit more than the time scheduled. And then the students had to be back on campus for laboratory and microscopy sessions after that course. And so sometimes the time that it took for them to drive, we have some students that lived in Mississippi and they were late coming to class. So again, we just decided that asynchronous was going to be better for us in our program structure. And so with this asynchronous platform, what we did was we converted the face-to-face schedule to accommodate an asynchronous schedule. And what we did was we would post the lectures that we would typically give in a face-to-face environment. We would post those lectures a week before they needed to look at them and review them. And so basically they had pretty much 2 weeks basically to look at the lecture material before they were quizzed on it. And what we also found with adopting an asynchronous approach was that the review sessions, when we did have review sessions online, they were more purposeful. It minimized a lot of the random questions that we typically get in a face-to-face environment, because they were able to go back and listen to the lectures and review the notes several times. So again, so that their questions could be more purposeful when we did meet online. Another challenge of teaching online is that my faculty member and I both had to learn to renegotiate the work-life balance. For me, I found myself constantly on the computer. I was constantly checking emails and responding to emails at night, at midnight, at 2 and 3 o'clock in the morning. I'm getting a lecture together. I'm reviewing a lecture. And the work-life balance was totally unbalanced. And when you're teaching online, you do have to set some boundaries for yourself, and also set boundaries for your students. And that was a bit of a challenge, because with our program, we have a culture of always being accessible, to our students when we were in the face-to-face environment. And so translating that to an online environment was a bit challenging, and it still is. It still has its challenges even now. And moving on with the challenges, we even though we decided that an asynchronous approach was the best for our program, we did, and we still do have challenges with that. When you are teaching face to face, there might be certain phrases and certain things that you say, in the classroom, when students ask questions, that you have to be very mindful when you are recording the lectures, and when you are modifying your notes. You want to make sure that those phrases and those things that you would say in a face-to-face classroom are totally in sync with what's being said in the recorded lecture, as well as the interactive assignments. And it's, and I didn't put this in the presentation, but it's also important to go back and listen to your lecture material to make sure that it's also in sync with your quizzes and your exams, because again, there might be things that you're so used to saying in a face-to-face environment that you perhaps did not say in your recorded lectures, but then those phrases and the things that you say are on the exams. So you have to be careful about that. And my faculty member and I, we did have some instances where that indeed happened. We also, because you're having an asynchronous approach, we have to be more accessible for questions. And so again, we did the group online review sessions via Zoom. We also set up discussion boards in each of our classes. If the students had questions about any of the lecture material, we encouraged them to post them on the discussion board in our learning management system, which is Blackboard. And we promised the students that we would answer all questions within the 24-hour period. We also made ourselves more accessible to the students by allowing them to schedule appointments for individual questions or issues or concerns that they may have. We also had to constantly remind students to manage their time well. We had to change our schedule. We had to change our course syllabi to, reflect the changes in the schedule. And, there were a couple of instances where, students perhaps forgot to look at the recorded microscopy session before we came to campus to actually look at it face to face at the multi-head. And we wanted the students to do that so that they wouldn't come to campus just totally unaware of the cells and the morphology that we were studying. And what we found with that is that if we required the students to look at the online microscopy session first, we found that when the students came for the face-to-face microscopy session, that overall, they were more prepared and they had more meaningful questions. And it also maximized the quality time at the microscope, as well as, eliminating a lot of, again, the random or perhaps frivolous questions. We also had some challenges with the online proctoring of the tests. One of the challenges is that when you are in a face-to-face environment and you have students on campus, it's a little bit easier to reschedule an exam if the students feel that they need more time to study, or they have 3 or 4 exams on the same day. And sometimes the students used to request, well, hey, can we move this exam to another day? Because we're feeling overwhelmed here. And we were very accommodating on campus with those situations. However, when you are dealing with online proctoring, when you schedule an exam in ProctorU, it leaves very little room for rescheduling. And the reason is that they have to let their employees know in a considerable amount of time that there is a test that needs to be proctored. And so you cannot wait until the last minute to say, well, I'm going to reschedule this exam and, I'm going to move it to the next week. Not so easy with a proctoring company, because they have to know ahead of time so that they can make preparations with their employees. And sometimes that block that you would like to schedule may not be available anymore because you did wait until the last minute. Another challenge that we faced with the online proctoring is that there were occasional inconsistencies with the proctoring employees' operating procedures. What we found is, that there were several situations where students, they were able to log on, they were able to, communicate with the proctor, but the proctor would not allow the student to take the exam because they were not on their own personal computer. I have 2 students that are roommates, and they shared a computer, and the computer was in one of the other students' name and not the other, and the proctor would not allow the roommate to use the computer because it wasn't specifically in that student's name. And so, we had to make arrangements for that student to get her own computer to eliminate that problem. We also had problems with tech issues with the proctor getting booted off for whatever reason. They were knocked off, or the student was knocked off, and so the student would call and say, well, hey, I can't take the test with the proctor. And so there were a couple of times where I had to proctor the exam myself because the proctoring company was not able to do it. So in summary, the teaching online may be perceived as easy, but it's actually more work if you want to perfect it and be good at it. So what are we thinking now? Even though we are still in the time of COVID, we are looking to the future to see what would we like to see happen post-COVID. There are several things that we adopted, during this time that we would definitely like to continue even after the pandemic is over. And we would, again, like to continue the hybrid format that we have developed, where we would still like to keep all of our didactic lectures online. We would like to keep our review sessions online. We would also like to keep our microscopy sessions online, and continue to have the on-campus microscopy and the labs. Another thing that we would like to do is budget for each student to have a microscope camera. That way, it will encourage more collaboration online. We can send the students home with slides to screen for homework. And if they want to, review those slides, we could easily do that from our home cameras rather than on campus, especially if the pandemic requires us to close down again like we had to this spring. Another thing we have been thinking about is the possibility of creating distant partnerships or collaborations with other laboratory institutions, and perhaps maybe create some distance learning through these partnerships and collaborations. So even though we were put in a very difficult situation at first, we were able, I would say, we were able to make lemonade from the lemons that we were given, and we are more tech savvy now because of that. We are more confident in our online teaching and the things that are required for online teaching. And in conclusion, I just want to thank you all for, again, joining me this morning. And I'm looking here at this beach, and hopefully one day we will all be able to get out on the beach comfortably without fear. But until that day comes, we will continue to dream about that day. So I'm going to go ahead and stop sharing. And I guess the floor is back with Amber.
Yeah, thank you, Keisha. It's great to hear how different programs, I guess, confront the challenging times. And I think many of us did similar things, but I think we can all learn from each other. And so I noticed we do have a couple of questions coming in, and I'll start that. If you guys have questions, it would be nice if you could type it in the chat. If you think it's too long, then after we go through any questions in the chat, I can open it up and you could ask your question if we still have time. So I guess for me, Keisha, I'm just wondering if you had to go back and do it all over again, is there anything that you would do differently? I know that we didn't have the luxury of, time in trying to create things in a meaningful way. We kind of had to hurry and scramble. So thinking back on it, are there things that you would have done differently?
Well, one thing I could see that I probably would have done differently is to get the students microscope cameras immediately, instead of waiting for that. That way we could have been able to communicate a little better. Perhaps I probably would have given the students, the first year students, an incomplete in the cytology prep lab course, just so that we could ensure that they really knew the material. I do. There were times when I felt like we were a little rushed with things, but because of the circumstances, we really didn't have a choice. So those are the two, I think, the two main things that I probably would have done differently.
All right, thank you for that. So I have a question saying, for clarification, when you say online microscopy, are you referring to instructor demonstration or student microscopy exercises?
With I'm talking about teacher demonstration. So what I would do is, like, let's say, for instance, if I wanted to review or go over pleural fluid malignancies, what I would do is I would take some study sets and record them on Zoom using the microscope camera, and I would send out to the students for them to review. And I would require the students to look at that demonstration before we actually came to campus to look at it face to face at the microscope. I hope that answered the question. All
right, thanks, Keisha. So another question. So great talk. Did you find that you had to modify your quizzes or exam format? The old way didn't really lend itself to online learning at this particular program. We are heavy on writing and drawing.
Absolutely. We did have to modify the quiz, the quiz format, and the exam format, just a little bit. Our Blackboard system has been pretty forgiving. We don't do a whole lot of drawing in our curriculum. We actually don't do any drawing at all. If the students do drawings, it's something that they have taken on themselves. But like for the written exams, we did have a lot of matching and things of that nature, and that it was a little tricky putting those into the Blackboard format. But we did do it. We were able to do it. Another thing that we did for the quizzes was we started using this thing called Microsoft Forms. We started using that in August. And with Microsoft Forms, we found that was, pretty easy to do, where you just, put your quiz in, and we would copy a link. We would generate a link and copy it and email it to the students and have it scheduled to go out to the students at a certain time. And with Microsoft Forms, we were able to record the quiz grades. I mean, that, if you log in, those quizzes are still there, and you can see, everyone's quiz grade. You can also go back and modify and change a quiz grade if you wanted to. So we were able to do that also. Yeah.
All right, so next question is, have you found test proctoring software to be effective? We are utilizing ProctorTrack, and I have been on the fence about utilizing it for upcoming finals.
I think overall, the proctoring software, or the proctoring company, we actually use a proctoring company to proctor our exams. So with ProctorU, which is what we use, we have our exams in Blackboard. Okay, they're still in Blackboard. So ProctorU doesn't give the student the test. They log into Blackboard and they open up the test. And ProctorU's task is to watch the student as they are taking their exam on Blackboard. So with that, with that situation, overall, it's been pretty effective. Aside from, the couple of challenges that I mentioned in my presentation, where there might be a crash with ProctorU and they're accidentally logged off or something like that. In which case, thankfully, because the exam is in Blackboard, if something like that were to happen, I could easily go in and proctor the test for them on Zoom. So I think it's I'm really not familiar with ProctorTrack, but I really think it's something that you should definitely consider and try. If it doesn't work out, then you can say, well, hey, I tried and it doesn't work. But I really think that it would save you a lot of time and stress if you left the proctoring to a third party.
All right, so this is a comment coming in. We tried ProctorTrack, but we stopped due to hacking of our MLS program students through the software. We use Canvas and utilize timing and use a variety of question types, multiple choice, matching, short answer, etc. All right, so I have a question, Keisha, that's, you kind of talked about work-life balance for faculty and how you're constantly online and doing things. I know that it's altered a lot of our social, mental, well-being. And I just wonder if you have had any students who have commented on their mental health, and if they feel more isolated, and if your class of students has done anything to sort of overcome those challenges.
I will say that when the pandemic first began and we were not allowed on campus at all, I did have students that commented that they did not feel very connected. to their peers. And so what we tried to do to kind of minimize, that loneliness or disconnection is that from time to time we would have like a little happy hour on Zoom where we would all get together and just talk about, how our week went, what's going on in our lives, just so that we could stay connected. So, thankfully, because of the technology that we have, there are still ways to stay connected, even when we were not able to come on campus. So that's just one thing that we did.
All right, thank you. So one more question. Have you used Zoom and your camera software to perform live microscope sessions with your students? Great talk, and thank you for sharing your experience.
I have, yes. So it's very easy to use Zoom and your microscope camera. Whether it's a Wi-Fi or if it's not a Wi-Fi, you can still do it. What you would do is you would just like with today, with today's presentation, I had to have my PowerPoint up before I could share it. Well, what you would do is you would go ahead and get your microscope camera up and running, and then when it's time to share, you just click share and find the microscope camera, and it's very easy to do. If you need any help with that, Donna, I can be more than happy to call you and walk you through. You just let me know when you're ready.
All right, so that's all the questions I have coming in. Anybody have a last minute question? All right, so a lot of thank yous. So thank you, Keisha, for taking time to share your experience with us. You might be getting a lot of emails asking you some more questions. I just want to remind everybody that we're having our second webinar on December 8th, same time, so 12 p.m. Eastern, 11 Central, and we'll have Barbara McGahey-Frayne from Indiana University, and I believe the title of her talk is Recruiting Future Laboratorians, Trials and Triumphs. If that's wrong and you're still on, Barbara, you can correct me. If you want to say anything else, then you can say something. She says correct, so great. We look forward to that next week. We hope that you can all join us then. And then we'll have a follow-up, the third session on the 15th at the same time as well. That will be kind of an update from the CPRC and some of the standards and guidelines updates and things. So we look forward to seeing you all next week. If you have any questions, comments, or anything, you can feel free to email any of us, Deb Sheldon or myself. And I'm sure Keisha would answer you as well on any questions you had related to her talk. So thanks again, everyone, and we look forward to seeing you next week.